But I noticed as I was growing, I would tend to really fall into this, where you're really just hanging on this kind of hinge right here and you lock out your knees. Now, what also happens when that is happening is your hip flexors or your psoas muscles get very, very tight, because your pelvis anteriorly rotates, kind of comes forward, and you see that it creates a little crease here. Now, without doing lots of hip openers to stretch this out, this becomes very, very tight. So doing all the cues that Jennifer is so good at, as far as micro bending in the knees, putting the brick in between your thighs, and really doing that rolling in, as well as thighs pulling up, because when you do that, you won't fall into this, because this is what happens as baby is growing.
Yeah, that's exactly what Sarah and I were experimenting yesterday
Yeah.
with her balloon. And she wasn't just imagining having weight. And she's like, oh, my thigh bones would go right back to accommodate that, and I get a really pronounced lumbar curve.
Right.
So we don't have to really worry about thigh bones back for pregnant ladies, but Kegels would be the important
Right.
and the strong legs. Psoas muscles. Yeah, I noticed you did tons of low lunges in class.
Yeah. Yeah. I'm also a cyclist, so being on a bike all the time, with this flexed was not helping me. So we'll go over what kinds of poses we can do for that to really stretch this out. Because the psoas muscle is a very unique muscle in itself. It attaches at the front parts of these lower joints. It's like all 5 of these. And it transverses through your spine and attaches here at the front bits of your hips. And so as they get tight, it just keeps pulling this more and more forward. And it really can be creating a lot of compression at your low back. So now to accommodate this kind of forward motion, what tends to happen is to create a nice plumb line from our heels to our hips to our shoulders. How we accommodate it is we just hinge backwards on our rib cage. And then we have this nice little rounded spine, and then our head comes forward. Okay, so this is not ideal posture, as you can obviously tell. And so lots of those standing cues of soft knees, inner thighs in, pulling kneecap muscles up, and then connecting pubic bone up to belly button and trying to lengthen out that tailbone. And we'll do some Kegel contractions and trying to lift up off of your rib cage and just realigning yourself so you're back in that nice juicy plumb line. It feels really wonderful. So the other thing that can happen is as baby grows, we have a nice long muscle, the rectus abdominis, that attaches the bottoms of the rib cage and goes all the way to pubic bone. It's that superficial muscle, that one that gives you the nice looking 6-pack, right? It stretches out quite a bit. There's a fascial line in the middle of that called the linea alba. It's actually just 2 pieces of muscle like this with a little fascia in between. That can separate as baby grows. Now, you don't know that, unfortunately, until pregnancy's over. But what that can mean, and I'll show you guys how to test for that, is we might have some weakness in abdominal muscles afterwards. And you'll see this in, men as well, because men tend to carry their weight more in their abdominals. And so if you've ever seen a man with a larger stomach get up and it looks like a little aliens coming out of their stomach, I don't know if any of you have ever seen that, where you see a little protrusion come out of their stomach as they kind of do this to get up. That is their abdominal muscle that's separated. Yeah. And so it happens in men as well as postpartum women.